The following information is intended for educational purposes only. It is not medical advice. The views expressed do not reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
Will a mask stop the spread of COVID-19? Will a mask help you or others? Will it make things worse for those who have the virus? What kind of mask is best if you have to wear one? And why is everyone just believing what they're told? Dr. Ernst is our guest today. He's going to talk about masks, and he's about to give you a health awakening. Well, welcome to the Health Awakening. I'm your host, Scott Laird. Are masks effective or not? Why has the whole world accepted masks without asking questions? Do they work? Are they actually the reason some countries have seen lower rates than others? Well, let's get into this with the holistic practitioner and host of the Ask Dr. Ernst show, Dr. Ernst. Welcome to the Health Awakening.
Yeah, thanks for having me. It's a privilege to be back. I think this is now my third time?
It is. I mean, you're a favorite guest. That's why we keep having you back.
Yes. So, let's get into it, right?
Exactly. Well, talk about getting into it. Okay, so it started with what? The truth of the matter, and then you did a lunch and learn on your show, and now you did something on July 4th. Tell us all about what's going on here.
So, it just started with the fact that, in Charlotte, I have a holistic practice, and we see a lot of people on a weekly basis. And the number one question was, okay, Dr. Ernst, as a patient, which mask should I wear? And I kept butting my heads going, you don't understand. The masks are not the protection. And so it's just constant barragement. I had people come in and say, I got a cloth one off of Etsy. I got this disposable one from Target. I ordered an N95. I even got some from Korea because they were cheaper. I mean, it was just endless amounts of masks showing up on my doorstep saying, which one should I wear? And I'm going to show you what I found that's going to blow your mind, especially as a viewer. And it comes from the New England Journal of Medicine. So I'm going to hold this up. But it's the New England Journal of Medicine. It was published in February of 2020. And in the article, it shows the electron microscopy. So that's a very special microscope that we can see microscopic particles. And they actually showed the average size of the COVID particle. So this is for me, this was the first. So it says, and I highlighted it, I don't know if you can see this very well or not, but it says that the diameter of a COVID particle varied from 60 to 140 nanometers. Now, this is really important. Masks are not rated in nanometer pore size. They're rated in microns.
Right, yeah.
You have to do this heavy conversion. So the challenge becomes math is now required to find out if your mask is working. So let me break it down. Small particle coronavirus, the tiny, tiny guys, they are 0.06 microns. So basically zero. The largest particle of the COVID virus is 140 nanometer. Again, where am I getting the numbers from? I'm pulling it from the New England Journal of Medicine. I'm not making this up. I'm just saying that's what they said. So let's do math. That means it's 0.14 micron, 0.1. So then I started looking and I said, okay, these disposable masks that Target sells for $1.99 or that you'll see at the restaurants, they'll say, we have them for $1 so you can order your food. What is the actual particle filtration capacity of a disposable mask? Well, they don't do 0.1 micron at all. So the largest coronavirus particle will pass right through this. Okay? They are effective at 3.0 microns. Now, let's do the conversion to nanometers. 3,000 nanometers. How big is the coronavirus particle? 140. So this thing is basically useless for someone breathing in exposed viral particles. Now, I got a bunch of flack on my Facebook post because they were saying, well, Dr. Ernst, I thought the masks are supposed to catch the droplets and the exhale. So yes, we realize we could breathe it in through this, but that's not the purpose. The purpose is to stop the spread to other people. Well, there was a study published where these researchers in South Korea were testing masks that people who had the COVID virus, they put the masks on them and they said, cough into it, please. And then they tested the mask's internal and external layers, and they found more on the outside than on the inside. And they went, how's that possible? Well, when you wear these, there's little gaps in the sides and on the front. So a chew comes out and they stick to the mask. Now, Dr. Russell Blaylock is a prominent neurosurgeon in the United States. And he was famously, we'll say, he's being criticized now. There was an article that came out and it says, could these masks be detrimental to your health? So this was the article. It was published on jpost.com. And what it says is that he was noting the fact that if you increase the concentration of particles on a mask, or you have salivary droplets or sinus droplets, then the wearer becomes the exposed patient, rebreathing their own particles back. And you actually increase the concentration of these droplets that are infected in nasal passages, and the olfactory nerves carry them to the brain. So even this neurosurgeon was saying, look, if you wear a mask, you are possibly reinfecting yourself, increasing your concentration, not protecting the community, and not doing what they were originally for. So the challenge I had was North Carolina came out on June 24th and said, everyone must mask up, mask, to protect the community. But in fact, we're actually increasing our exposure, and we're not protecting the community because masks can't block the transmission of the droplets or the virus.
So now you mentioned something else on your show. I watched a bit of it, your Lunch and Learn, and real quickly, you mentioned that it also affects the eyes. Tell us how that happens.
Well, so same thing. So again, if I wear this, or let's say I spend $8 and I go to Amazon and I get a dual layered cloth mask, which by the way, pore size of a cloth mask is about 20,000 microns, okay? Nothing for the virus. These things, when put on, they attach so tightly and you've got it up around your nose that the only way for air to come out is this way. So if I have COVID and I forcibly push up the air with the droplets into my eyes, again, re-exposing myself through mucous membranes. So do you see how it's not protecting the spread? If anything, in my opinion, it's making the people who wear the masks more likely to reinfect themselves.
Wow. Well, we're talking about masks and the effective or ineffectivity of these masks. We'll be back with more from The Health Awakening. Stay with us. And welcome back to The Health Awakening. Before the break, we were talking with our guest, Dr. Ernst, about masks. And Dr. Aaron, something we wanted to get into, we didn't get into the last segment, was, well, if you're wearing this mask, I mean, really, what's the issue here? Who is protecting whom?
Yeah, so it boils down to what type of mask have you chosen? And see, that's also part of the challenge. There's very little to no regulation on everyone should wear this mask. So again, we have some people walking around wearing an N95 rated mask because supposedly it catches 95% of the particles. Is that true? 0.3 microns. N95s will catch 95% of 0.3 microns. We talked on the first segment, even the largest COVID particle is 0.1 micron, passes right through. What if you're lucky enough to get an N99 or an N100 as they call it? Its rating is against 0.3 microns. Here's what I mean. I have hundreds of patients that come to my clinic every week. I did a survey and I said, listen, if you could pick this mask, an N95 with the special sort of, I'll call it additive, we'll talk about this in a second, or you could pick a classic N95 without the special additive, which one would you choose? Now, out of curiosity, what do you think the answer was?
I'm thinking the one with the flap because it looks more technologically advanced.
Yeah, so all of my patients said, oh, this one is 10 times better. Now, I'm going to read to you from an OSHA statement what these things are designed for. An N95 respirator mask, and this is, by the way, this is the respirator here. It is a valve that allows for the positive exchange of air from the wearer to exit so that they don't rebreathe their carbon dioxide. Okay, so these masks are unvalved. You're going to breathe more of your own air back in, and they cause hypoxia. They cause an acidity state. These are worse, in my opinion. Now, you wear this one because you think that special plastic flap is going to now filter your air. It is designed to allow for the expression of your breath and your droplets into a contaminated environment. Respirator masks are only certified for use in contaminated environments so that you don't care if you increase contamination. Now, they have a slightly better filtration rate, but again, against 0.3 microns. So here's the challenge I have. If I'm COVID positive and I don't know it, I'm asymptomatic and I'm a vector, I'm a typhoid Mary, I'm a spreader, and I wear this and I go out in public, every breath I have, I'm actually spraying the viruses into the air. So I'm actually harming the citizens around me, but yet I'm protecting them. I'm so sorry. This is just absolute absurdity in my opinion. Now, if you go deeper and you get lucky enough to find a surgical mask, can they filter 0.1 microns? Yes. Okay, that's the benefit of surgical masks, but they are designed for a sterile environment, like a scrubbed out surgical suite. They're not designed to be put on outside or in a public space. The moment you take a surgical mask and put it on with contamination, you've contaminated the mask. They're rated for about maybe 20 minutes max in the environment. So you're going to clog it. And then again, you're pushing the air with every breath into your own eyes and you're spraying it out the sides. You're actually increasing concentration exposure to yourself and to those who you're trying to protect. This is why I have such a hard issue with this mandate. If the mandate was for protection, they should have said, let's make our citizens wear what actually works.
So what actually works then?
The research states the only shield that you can wear, a face covering, is the sort of plexiglass plastic shield. But here's what they are. There's basically either they're a pair of glasses that have no lenses and it has a face plexiglass shield. So it keeps your eyes from having splatter go into it. It keeps your face and your mouth protected from the other person. Again, remember, masks are not designed to protect you. They're designed to protect the people and to flatten the curve. So if I wear a shield unmasked and I have COVID positive 19 and I spray the viruses out, well, the face mask will catch it because it's plexiglass, and they've proven that it's 95% blocking, even as close as 18 inches. And we're going to go a little deep here when I say this. Why did the government not tell people that the shields are mandated, but that masks are, but then have a little blurb in here saying, well, you could wear a shield if you want? I think it's because, unfortunately, they know that that would flatten the curve to zero. COVID would be done in 30 days. We wouldn't be selling millions of dollars of masks. Etsy has a report online, 133 million in sales of masks in the last 2 months. Guys, it's about money. It's about control. It's about reinfecting the population. It's actually about spreading this to try to make this COVID thing last longer than it should, in my opinion.
Wow. Okay, well, some revealing stuff here with Dr. Aaron Ernst. We'll be back with more from The Health Awakening. Stay with us. And welcome back to The Health Awakening. Before the break, we talked about what not to wear and maybe what to wear if you need to wear a mask. But Dr. Ernst, we want to talk now about something we haven't talked about yet. We've talked about how to protect others, but how do we protect ourselves? You have something you call an internal mask. Can you enlighten us?
Yeah, so again, it comes back to the concept that, as human beings and as God created individuals, we have been gifted with this, immense power called innate immunity. And it's this concept that your body is already designed to handle pathogenic exposures. So it's going to violate those of you who believe in the germ theory, which states that a virus causes illness and disease. So if I believe in the germ theory, then I need to sterilize my environment. I need to wear masks. I need to shield myself from the exposure, because if COVID got on me, I'd have the infection. Well, we know this is not true because not everybody who's exposed expresses symptoms or even gets the disease. And the question becomes why? Now, if you think about it, your immunity And the efficiency of your immune system is going to determine if you get a cold, flu, sickness or not as an expression. Okay. Can you naturally fight it off, build an immune response, destroy it, and have it leave with you asymptomatically? So these people who are supposedly the vectors and the carriers that have no symptoms, but have the infection, they are the ones that have stronger immunity than those who got the infection and got the symptoms expressed. Does that make sense? Weak immune response, you get exposed, you get sick, you get the symptoms, the cough, the fever, the loss of smell and taste, and all the COVID symptoms, and potentially a cytokine storm that leads to respiratory failure and death. Or you're the person whose immunity is strong, virus comes in, you don't have any symptoms, you naturally go through a response, you build antibodies, and you fight it off without even knowing it. Okay, so now that person has built a sub-level immune response, and it's sort of this IgM antibody reaction. Now, the moment that person gets exposed a second time or a third time or a fourth time, the body doesn't go through the same immune response because it says, oh, I've already seen this before. I know how to get rid of it. And it's already pre-programmed. But this time it builds an IgG antibody response. It's longer lasting, longer standing, and it prevents the spread. So your internal mask is the development of an antibody reaction such that you've now proven herd immunity to you. So as a functional chiropractor, we teach if your spine is free of interference, you are neurologically healthy, which means your organs are firing at their optimum potential. Second layer is we know science, microbiome, gut, leaky gut, 80%, 70% of your immune system are the bacteria in your intestines. So you need to make sure you're eating a healthy diet. Lots of raw foods, fermented foods, probiotics. We want to keep the grains, the processed, the hydrogenated oils, all the crap, as I call it, out and just eat real food. It's like what your book talks about. Then we have third layer, which is toxicity. We live in a toxic world. Most people do once a quarter juice fasts or an annual cleanse that they picked up at Whole Foods on aisle 6. Okay, those aren't detoxes. We're talking about testing your liver for phase 1, phase 2 efficiency. We're talking about making sure your bile and your gall systems are draining properly, making sure there's no heavy metals or pesticides or herbicides. We have tests that you can do, that you can run urine samples and blood samples to find how much chemicals are inside of you, and then we chelate, we target, we pull. So we combine chiropractic with diet and detox, and there's a synergy that boosts your immune response. There's the internal mask. So I don't have to worry if a COVID patient sneezes on me, because I know the particles will go in, I know the virus will be in my blood, and I know my body will say, I've seen it before, got the antibodies, nerve system check, gut check, no toxins or low toxins, crushed, done, I'm my own mask. Does that make sense?
It does make sense. So now with that done, so if we're having a healthy immune system response already, what do those of us who are doing that do when the vaccine comes about? What do we do then?
Now we're talking about a whole nother ball of wax, because vaccine is going to be something that is to try to tell people you don't have the immunity, you haven't had the exposure, we don't know if you're going to make it, so we want to create a false immunity response. So I'm not a vaccine expert, so I can't make, scientific claims behind this. But from what I do understand, a vaccine-induced immunity is a sort of like tricked response. Remember, I told you IgM first, IgG second, and an innate response. What a vaccine does is it sort of gives you this acquired immunity. That's why they constantly wear off. Why do you need the flu vaccine every year? Well, it doesn't last forever. Innate immunity, once you have it, is forever. So even if they come up with a vaccine, first, they're going to have to make sure that all the strains are covered. Second, you're going to have to get this thing every year. Third, vaccines carry toxins and other things inside of them. We can go down the conspiracy theorist route if you've seen it about what they're supposedly putting in the COVID vaccine. I've seen everything from DNA particles to RFID tracking systems to possibly even codes that would allow an individual to be monitored to find out if you actually got it or not. We're talking potential marks, if you guys know what I'm talking about. So oh my God, that's a whole nother ball of wax. But in my opinion, nothing from the outside is going to fix an internal issue. You have to look at health from the inside out. You can't make yourself immune unless you become exposed and let your body go through the natural reaction. Now, I got a lot of flack on my Facebook Live because people are saying, well, what about those who are already susceptible? Are you saying that someone with cancer should actually go out and try to get exposed? No, they're immunocompromised. Be smart, people. We don't want that. We need those people to be taken care of holistically or medically, but be careful. They are the worst people to be wearing masks because what are they doing? They're already immunocompromised. They're masking up. They're increasing concentration to themselves. They should be the face shield people all the time. If you have a health issue, you should wear a face shield. If you're concerned, if you want to truly stop the spread, wear a face shield. Don't wear a mask. But yet, again, what does this thing say? Mask, mask, mask. Now, I don't know if you know this or not. There are 11 exemptions in the state of North Carolina that you can pull, one of which is a medical. So if you have cancer, heart disease, diabetes, MS, Parkinson's, Alzheimer's, a hangnail, if you have a diagnostic condition, you can say, I'm medically exempt. And there's even a statement in the document that says that you cannot be forced to provide documentation or proof of your medical exemption.
All right, thank you, Dr. Ernst. We'll be right back with more from The Health Awakening. Stay with us. Well, welcome back to The Health Awakening. We've talked about all things masks and internal masks. Dr. Aaron Ernst, thank you for joining us today. If folks want to find more information about you and what you are talking about, where do they go?
Well, that's the beauty of today. There's so many channels. So think of it as like your master key to unlock every page possible is Ask Dr. Ernst. Every Saturday here in the Carolina region, 3 p.m., I host the Ask Dr. Ernst show, so you guys can tune in and check with that. So Facebook is where we do all our live streams, our videos. I have a clinic here in Charlotte locally, which you can see on the website. So the beauty of it is your key to unlocking your internal mask is Ask Dr. Ernst. And that's Facebook, Instagram, YouTube, Twitter, you name it, or the .com.
All right, thanks very much. If you have another question, just ask Dr. Ernst. Thank you for joining us today on The Health Awakening. We'll see you next time. Thank you for joining us today on The Health Awakening. You can catch the replay of this episode and see our complete show archive at healthawakening.tv. For more information about our guests today and all they have to offer, please visit their website on the bottom of your screen. And please remember, the information you saw today is intended for educational purposes only. It is not medical advice, nor do the views expressed reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
Shalom, Toro fans. Give this video a thumbs up and share it with a friend. Tap the subscription button and the bell icon, and I promise to update weekly with in-depth biblical research. Be sure to download the new michaelrood.tv app for both mobile and home devices for even more commercial-free content.